Peptides for back pain. Here are all the different peptides, some that you might not even think are peptides, that can help with back pain. All right, so to understand why I'm including some of these in the list here, you want to understand what a peptide really is. That's just a short protein. So technically, any string of amino acids under a certain point is going to be considered a peptide. That's why insulin falls into this category, as well as the more exotic ones like the BPCs of the world and tesamorel and that kind of stuff. So that's where I want to start. Collagen peptides. Collagen peptides are critical because you don't get enough of the amino acids within them in your normal diet typically. Unless you're like my wife, who actually prefers the chicken skin and bone marrow. In most cases, we're not getting a whole lot of the glycine, proline, hydroxyproline, all those that are in a collagen peptide. Well, if you have any sort of little micro tears, little minor injuries in the tendons and ligaments and all the connective tissues in our bodies, your body's kind of scavenging for how it can plug those gaps with limited resources. And so if you give it really all that it needs, you're going to kind of fix that bottleneck, and the body can restore itself in certain areas where collagen is really necessary. It's not analgesic, so it doesn't actually directly attack pain here, but if it's part of a kind of recovery support blend, then it's going to help you. So again, go back to the collagen, vitamin C, general protein supplementation, and you do that with exercises that are good for back pain. Now, there's a really other interesting effect that we're noticing on GLPs, and there is some debate as to the extent of this that is independent of weight loss, but there seems to be an anti-inflammatory effect. Anecdotally, I've seen this in my patients a lot of times. They'll notice a couple weeks in, they haven't lost a ton of weight, yet suddenly they are noticing their aches and pains are getting better. And now the reason why you're all probably here, the peptides, the ones that you think of when people say peptides. So there isn't a ton of research in this case, as it is with a lot of the cases with peptides, but we're going to talk theoretically here, and I'm going to give you my usual caveat, not FDA approved, discuss with your doctor, don't just order these things online. But if you're going for something on the anti-inflammatory side, that's where TB500 or BPC 157 or some of the other ones that have been known to have some what we call immunomodulatory properties. So they kind of affect the immune system in terms of calming down some of the inflammation. So all in all, peptides has a lot of different things that fall under that umbrella there. There's the obvious stuff, the peptides, but also collagen peptides and, teriparatide and those sorts of things. But this is just one set of different therapies that may be beneficial for back pain that will, complement really well the other stuff, the physical therapy, the nutritional changes. So if you're able to break that cycle of inactivity, pain avoidance, and then worse inactivity, and then worse metabolic health, and then worse pain, and all that stuff, then mood issues, and that worsens pain. You can break that cycle with any one of these pieces, then you can get those compounding benefits.